Well, back in November, I went into the emergency ward for another illness, and I found out when I was in the emergency that I had had a heart attack.
Well, this is the second time around for me here. I have probably 4 or 5 stents in my chest.
I suffered an aortic dissection. I was operated on for an ascending aortic dissection in September, and I spent a month in the hospital afterwards and another month at home in home care.
People are very scared, frightened. Many people have never exercised a day in their life, so they have no idea what to expect. They've been through a lot, whether they've had a heart attack, whether they've had open heart surgery, they've had stents put in. They come in here very afraid. So we're really here trying to put them at ease and trying to get them feeling better. They're afraid of what can I do? Can I go outside and mow my grass again? Many people just don't know what to do. So they come here hoping and looking for us to help them increase their knowledge of what they can and can't do and how they can learn to live with cardiac disease.
Rehab is exercise, and exercise is critical for a heart patient. And it's so fundamentally important after a patient has had any kind of event like a heart attack or a bypass operation or an angioplasty. And a lot of people are afraid to do anything. So rehab gets a patient and monitors them and starts them out at whatever level they can start at. And I've never had anybody complain that they didn't get something good out of rehab. Everybody likes it.
When I first came here, I was having a hard time even thinking straight. I had the shakes. I just was a mess. And the more I came to cardiac rehab, the more it helped me. The people here are fantastic. They're behind you all the way. They help you learn how to use all the equipment that's around here. And you don't have to feel that you have to do a certain thing at a certain time. You do it at your own pace, and it was my lifeline.
Yeah, I couldn't do it without their help. I couldn't go outside and do this at all. I couldn't go to another place and do it if it was a regular, like, old gym type of thing as this is. You get the support and the togetherness and all that right here, and that's what counts. Yeah.
I think that that's one of the things that people who suffer from these sort of traumas, injuries, illnesses, whatever you want to call it, I think that what they miss is the support. It's a really lonely feeling. There's a lot of days spent at home alone. There's a lot of days where you don't know what's going on. There's a lot of things, discomfort from your surgeries. And these people, just being able to have people here to talk to when you experience those things was, for me, a godsend. It was just so much of a support group for me. It was excellent. It's been an excellent thing for me all the way around.
I mean, there's essentially nobody that can't do rehab, even no matter how much of a couch potato you are after you've had a bypass, let's say. No matter what your level of debility is everybody is a potential candidate for rehab, and early on too. We don't wait. We usually start patients pretty soon. There's no reason to delay.
Our staff is all RNs, registered nurses, and exercise physiologists, and we are all trained in cardiac. We have background in cardiac care. So we can give our patients that more one-to-one and answer any questions that they might have. Our program also is accredited by the American Association of Cardiovascular and Pulmonary Rehab. It's quite a undertaking to get that certification, and we have to renew every 3 years.
And I would recommend anyone that has a problem, the heart, any type of problem with your heart attack, anything, had surgery, come to cardiac rehab, because it will get you back on your feet and make you feel like a person.
Yeah, I couldn't do it without their help. I couldn't go outside and do this at all. I couldn't go to another place and do it if it was a regular, like, old gym type of thing as this is. You get the support and the togetherness and all that right here, and that's what counts.
First of all, you're going to get better and you're going to feel better. But to feel better, you have to take some initiative too. It's not just going to come back to you. So you need to do something that's going to get you feeling better. And these people here, this place here, these machines here are going to help you get back that feeling of normalcy and getting back to where you're going to feel better.
Patients want to be able to get back to doing and feeling just how they were prior to their cardiac event. They want to be able to go out and mow the lawn, go bowling. We've even had people want to play softball, and that's what they want to do. They're afraid that they can't do that anymore, so with our encouragement, our support, we are able to provide that goal for them to get back to their healthy life that they were experiencing prior to their event.